Time management is a common problem that GP trainees face. In this video, I'm going to share with you practical insights that you can use to compress your consultation within 12 minutes. Make sure you watch this video until the end if you don't want to miss the insights. Common reasons why GP trainees take too long in the consultation is because they're not priming their case enough or their consultation is disorganized. If your consultation is not structured, there's no organization, then you will find that you're going to take more time to take the history because you're not taking a very targeted history. In order to consult within 12 minutes, it's important that you learn how to prime your case and make sure that you're organizing your consultation. Playing it out in your mind before you even start the consultation will help you. The 3-minute reading time that you will have is critical how this consultation is going to play out. Utilize information that you're given. This is a 63-year-old gentleman who is presenting with tiredness. He has a background of type 2 diabetes mellitus, and we can see that he had an annual review recently, and the blood test and assessment appeared to be satisfactory. So think how you're going to start this consultation. In the beginning, it's important that you ask open questions to facilitate the narrative, get the patient's story. In the exam, the patient will have a script to tell you. So you want to get as much information as possible by asking open questions in the first minute so that you get the story out there. So once you've got the story, then you'll get a better idea what the patient is experiencing. When it comes to tiredness, it's important that you clarify what the patient means by the tiredness. So does it mean that the patient is feeling fatigued? Does it mean that the patient is weak? We need to know exactly what the patient means. So think about what are the common causes of tiredness. In this patient, I might think whether this patient's been stressed, whether the patient is not sleeping well, whether the patient is depressed, feeling low, because that could also cause tiredness. Also think about what are the red flags that you want to ask. Asking for presence of red flag will help you to make a safe assessment. A common misconception that GP trainees have is thinking that you have to make an inquiry, an exhaustive list of all possible symptoms to make a safe assessment. That's not necessary and it's not practicable for the amount of time that you've got. So ask what are the common causes and serious pathologies you want to assess for. Once you've done that, then you will come to a working diagnosis. It will help you to narrow down what might be the possible cause of this tiredness. Sometimes it could be due to multiple factors. So it might not be due to one cause. It could be because the patient is depressed or the patient is also a carer, feeling stressed. So there could be multiple factors in the history. The second challenge is clinical management. A lot of GP trainees struggle for clinical management. They're very good in data gathering in the first half, but when it comes to clinical management, they don't really know how to manage the patient. They kind of rush it and do it in a way that's very generic. So if you want to score high for the SEA, it's important that you practice and refine your clinical management. The various steps in clinical management. First thing you need to know is that what are you going to solve? So you need to prioritize what problem you're going to solve and have a discussion with your patient. Involve the patient in that discussion, as in what are the treatment that you'd like to recommend and what referral you need to make. By having a discussion with your patient and integrating what the patient told you in data gathering so that you can take that into account to discuss your clinical management, that's going to allow you to share the management with your patient. A common misconception is thinking that just by sharing a list of options to your patient, you're going to share management. But that's not really what you need to do. To share management with your patient, it's important that you involve the patient in that decision and have that frank discussion with your patient, especially when it comes to significant medical decision that you might need to make. So by involving your patient in the discussion and making the decision with the patient rather than making the decision for the patient, then you're more likely to score well in clinical management. Have you found the insights in this video useful so far? If so, you might be interested in SEA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. The last challenge is confidence. Maybe you're thinking that you're not very good at this topic, and what if that comes? And you're anxious about how you're going to perform on the day. This is a common issue that GP trainees face, especially when you have to consult 12 different cases in one day. There's 4 stages of competence. The first level is when you're unconsciously incompetent. This is when you might not even know what you don't know. The second level is when you're consciously incompetent. So now you understand that there's something that you might not know. So you have a self-awareness what you're not good at. The third level of competence is when you're consciously competent. So this is when you're aware what you need to do and you know how to do it and you can do it. And the fourth level of competence is when you're unconsciously competent. This is a level where you're master in the game. So you can actually do something without having to think about it. It's like an intuition that you've got. My question to you is, where about at the stage of competence are you? So if you're not very competent, it's normal that you don't feel confident. Maybe you have not practiced and refined the consultation to the level that's required to pass the exam. So you still have time to prepare. It's important that you give yourself a good amount of time and plan your preparation so that when it comes to the day of the exam, you're at your highest level, so that whatever cases that might come, you feel confident and you can navigate the cases. Even if you might not know what to do in the case, you can still score some marks by doing what's safe for the patient. To grow your confidence, it's important that you show yourself evidence that you're making progress. By showing yourself that you're making progress, then you'll be more confident to consult. So an example would be, look at your recording maybe a month ago and compare it to what you're doing right now and see whether you have made some progression. By doing that, you feel more confident because you can see that you used to do something and now you're doing something better. So it's important that you have these small victories. As you're going to develop your competence, then your confidence will follow.
What you taught me or coached me with about the pivotal phrase. So that meant that by that time that I should be saying, I think this is, I know you were wondering this, if you have got this, but actually from what you have told me and the examination, I think this is it. At that point, it should be 6 to 7 minutes so that I've got time to have shared management and discuss with the patient. So that really helped and gave me more time with management. And and I think for most of the cases that I submitted, it meant that things like safety net, saying we've covered a lot of things, what would you like me to go through again? I would have done that. So there's no doubt, in the examiner's mind, what we are doing, the next steps. So yeah, pivotal phrase, pacing myself and just coming across as, we are doing this and speaking a bit faster and leaning forward, like my body language. Sometimes I would lean back and say, So people feel like they need to add more, but when I'm actually just sometimes naturally like that. So yeah, so that's what I did.
If you found this video useful, you might want to watch the whole interview here. Click here to watch it. Take care, everybody. Bye-bye.